Good morning, everyone, and welcome to the 18th budget work session for the Multnomah County Board of Commissioners. Audience members, I want to start by asking you to please silence your electronic devices. And for those presenting today, please turn your mic on when you begin speaking and off when you've completed your remarks. For all presenters, please state your name for the record before speaking or responding to questions. And we have had all of the scheduled department briefings on the budget, so now the rest of the time is going to be mainly follow-up questions for different departments and then walking through amendments that we have from the board. So I see Christian Elkin and Jeff Renfro here, so I'm going to turn it over to them to help set the stage for today.
Fantastic. Thank you, Chair, Commissioners. Christian Elkin, County Budget Director. I use she, her pronouns. You have some packets before you, so I'm just going to walk through kind of where we are in the process, where we are with amendments, and then what information is available. So where we are in amendments, we have a total right now of 34 board amendments. That is excluding the 4 revenue amendments that were brought forward to be able to allocate for the board. So I really just want to focus on the allocation part as we think through this, and then we'll circle back to the revenue amendments. Those 34 amendments would increase the general fund by $18.9 million in one-time only funding. If we were able to fund all of them, there would be $7.1 million in ongoing general fund. There's $1.3 million in other funds, $610,000 in supportive housing services, one-time only, and $767,000 in SHS ongoing. One thing I want to note is last year we did have amendments that used Medicaid revenue to offset and allow us to do expansions. While there is Medicaid revenue in these amendments, we're not using it in the same way. So mostly this is restoring positions where we buy back a portion of the position, and when we're able to do that, it brings alongside it Medicaid revenue that helps fund the rest of the position. So it's like a 33-66 split there to do that. And so we're accounting for that on the sheet so that we can tell the TSCC, yes, we knew that was coming, but it's not being used in the same way. So I just want us to be really clear about that revenue and how that's being used. One thing that was just handed out to you all is it's called the Multnomah County 2027 Budget Work Sessions, Proposed Work Session Agenda. One of the things that is in these amendments is that we have similar amendments on similar topics. And so we have some themes related to those. Employment services was a popular theme, the culturally specific day center, eviction prevention. So those are some of the things that over the next few days we'll be working through to figure out how we would want to restore some of those services where possible. And so I just wanted to let everyone know that this agenda is there, available to you. So what I now want to walk through is the packet that I handed out. And so you have 3 items in front of you. These are all on our website as well. So let's start with the big sheet, the big math sheet. So this is all of the amendments that have been proposed to date. Hopefully correct, but I know there is currently one error on this sheet, and I want to point that out. So Amendment 7B, we need to remove one of the co-sponsors on that. So that is happening both on this amendment sheet and here in the packet, and then that is already on our website. I apologize for not catching that in the thrash of getting all the amendments and the updates. I did miss that, and so I apologize to both commissioners. So that will be updated. And then also I've asked your staff to look through this. These are really big packets now, and we're getting to the space where like a small change is easy to miss as I'm getting through everything. So I do want to make sure that these are as accurate as humanly possible. So one thing that I will ask is any amendments that you bring that we really daylight what's being changed in them so that like we can hear it, Jeff can hear it, my team can hear it, and we can kind of have that group approach to making sure that it's not just Christian trying to catch everything that's changing as we're moving through this process pretty quickly. So, back to this sheet.
So I have six things I'm going to lay down this morning that will change the sheet. Before we get into discussion, I think I want to lay those down, just so that I'm not going, oh, but I have changed that.
Great, that would be great. And I'm not going to walk through this one by
It's
one.
mostly the pay-fors that have changed,
Okay, great, Commissioner.
and a couple that have been, that now are no longer needing pays for.
Fantastic. Did you want to start that, or do you want me to just kind of explain this? Okay, fantastic. So basically, I just want to walk us through the sheet so everybody knows what's on it collectively. At the top are the revenue amendments. We show those as negatives, even though, well, there is one positive because we're actually decreasing that revenue, but we want to show additions below as adds, and then so we show the revenue as negative where we're increasing revenue so that we can do the math to show the offsets there. I just wanted to explain that for everyone. There is a footnote there on it. And then we have each amendment, crossing my fingers, as they came through the door. For updates, we haven't taken them off the sheet and moved them to the bottom of the sheet because that is a lot of like reworking of numbers and like connectivity there. So what you can see is it, if an amendment is at like 1D is our first one, that is the fourth iteration of that amendment. And so we're just trying to track them that way. And you can see on the left-hand side, what we have is the proposed additional expenditures. And then by the funding source and whether or not it's ongoing or one-time only, and if any FTE are impacted. On the right side are the proposed expenditure offsets, and that's showing if the amendment is balanced and where funding would come from to support the additional expenditures. And you kind of just walk that all the way down. And then when we get to the bottom is where you start to see where we're doing some math, saying, okay, this is how much one-time only general fund has been proposed. In additions, this is how much has been proposed in offsets. Right now, theoretically, if you looked at this, you would think we were close to being balanced. I think there's only one amendment that does not have an offset currently. However, our next spreadsheet that we provided to you all is this spreadsheet here with it says the FY 2027 revenue amendment balances. As we did last year, we do have the revenue available, but it's oftentimes used in multiple amendments, which means that it's truly not balanced. And so we're keeping track of the offsets that have been proposed and then doing the math here for you to show that we have $2.8 million in one-time only revenue available to appropriate and $325,000 in ongoing general fund to appropriate, and then the amendments that have identified. I do want to say a lot of the amendments came in and just said revenue offset, and so I've just collectively been using Amendment 1, 2, and 4 as the one-time only pool that's available. And so as those came in, it was just like, you know, I could change the title to just be Revenue 1, 2, and 4. But trying to like figure that out was, it almost felt like it was not, in the energy and the time that I had, like trying to figure out which one was going to which pot of revenue. I just mostly just assigned them all to Revenue 1 because that was the biggest pot of money that was available. But collectively, we'll need to figure out, we know we have $2.8 million. We need to collectively figure out how to balance the budget within that $2.8 million of one-time only funding. So then you go down and you can see after these amendments that we're still just under $2.8 million in unbalanced amendments for the one-time only funding, and we're $275,000 unbalanced for the ongoing general fund. And then the final portion of your packet is just the explanation of the revenues. So you have the summary sheet, which is the big sheet, and then you have the packet of revenues starting with the chair's revenue amendments and then leading into the expenditure amendments that we talked about. Yes, this big packet. All of this is for the viewing, for those who are viewing, all of this is on our website at moltco.us/budget. Under fiscal year 2027, there is an entire tab for amendments, and we update that and put the date that we've updated it on in the document. So this is all updated as of last week, which was May 20th. And then we'll try to more now in real time update these as we're moving closer and closer to budget adoption. Jeff had notes for me in here, so I'm going to make sure that I didn't miss anything that we had talked about yesterday. But I think that's where we are.
Can I ask, and maybe it's on a different sheet, for the ones that receive Medicaid match, can I have, like, yes, we would be spending 165,000 general fund. What is the total amount of money that actually creates?
We can provide a summary for that. The ones that you'll see mostly on this sheet, which is not called out, but it is called out in the packet where I have identified that there's Medicaid match coming. We tried to do that in that top line section where it was like FTE impacts, revenue impacts, those types of things. I got to put my glasses on. Sorry. So I believe the first one, Commissioner, the first one with the Medicaid match in it is 17B, thank you, which is that's the 3 positions, I believe you call them MMA, which is the long-term supports. So you can see there's $165,000 in ongoing general fund that would be needed. It's funds 3 to FTE, and then in other funds, there's $423,000, and that's the Medicaid revenue that would be generated to support those positions. And then the next one, I believe, is amendment number 25. That's the housing navigator position. So that would need $74,000 of ongoing general fund, and then it would generate $116,000 in Medicaid match to fund that 1 FTE. And I believe those are the only 2 that we have identified with Medicaid match in them.
My eviction prevention one will, but I'll make sure you get the updated so you can.
Yeah, I was waiting on that number, and I was working back and forth with Sarah Morrissey and Rachel Pearl, and so I just wanted to, I didn't put it in here.
Yeah.
I just wanted to make sure it was like final before, but that will go in onto the sheet. Thank you,
Can
Commissioner.
Amendment number 24, those are in direct clinical services. Can we find out how much they bill Medicaid for?
You can definitely ask that question, Commissioner.
We'll say that we have, all of the departments are here in the boardroom. Thanks, everyone, for making the time to be here, especially in these last work sessions that we're having before we vote on the budget. So as questions come up, that we do have folks in the room so they can help answer them if they have that information at their fingertips. And we do plan to bring forward both Health Department and Homeless Services Department this morning for follow-up questions that folks have.
Should I go ahead and just share my changes? Because it just update things. So the first one, this is I would describe it as a cleanup. It's relating to Commissioner Amendment number 6. It's the second amendment, and this is the pretrial. And there was a program.
Sorry, Commissioner, can we, do you know which one that is? Because I had to take everybody's and then renumber them for the county-wide one. So I think pretrial, I'm gonna grab it
It was described as my,
Number 9 is the county-wide one, just for people who are following along on this big sheet.
okay. Well, let me make sure and write it down so I can follow along.
Great.
Yeah, thanks. Okay, it's number 9. So I had introduced an amendment because there was a program offer with $800,000 in it for Close Street, and it turns out it's not a thing. There's no money yet. It is an ask of Congress, but it's not actually money, so it shouldn't actually be in the program offer. I also, it still maintains the $1 million that had been allocated as potential pretrial funds, and also, and connects it to the framework, and then references also the amendment, Commission Amendment 32, but I don't know what the county amendment is, the one that I'm doing with, have with Commissioner Jones-Dixon. But it's essentially just removing the $800,000 that 1,000. So, pass that around. Okay, the next one is, this is my amendment number 5. It's the GIS one. I don't know what the county number is, but if you tell me.
Commissioner, that is amendment number 8B.
18. Okay.
Sorry, I said 8B. Did I not?
8.
Yeah, sorry.
So this, what it does is it shifts the position, the GIS position. I had it going into DCS, now it's going in DIS-ECA with a dotted line to the Elections Division Director, so that the priority scope of work is with the Elections Division as called out in the audit and as requested by the Elections Division, and freeing up when the individual is not working on elections GIS work, can do broader DCA work. And the pay for on that is the chair's revenue amendment. All right. This is my commission amendment 11, but is, I don't know what the, I sent enough that they should go around to Jeff, but,
We're just missing somebody
oh,
to pass them.
I'm passing, oh. So this was an amendment around the leadership security detail. I was putting money into contingency. I've essentially changed the approach that they're still in January. The Director of Workplace Security preparing a report and analysis of the first 18 months, including the contract terms and the vehicle, comparing it to other comparable public contracts, and then providing potential cost savings for those protective security services deemed to be needed, and to make recommendations, but the money is not going into contingency. And what's the countywide?
The countywide amendment number is number 21.
And most of these changes are based on feedback, and then also looking at where other commissioners provided amendments and trying to find some places where there's some overlap. Okay, this is amendment number 12. I don't know what the countywide, that relates to the East Portland Neighborhood DA.
"23," the crowd says.
Okay. What I've done here is changing the offset, and the offset is with $279,000 in vacancy savings. And this, what you'll see overall is that generally I have taken vacancy savings in the places where there would be non-critical and just done a first quarter. And I'll share all the scoping of how I got that number. And I'm also waiting for some pretty significant feedback from the health department that I asked for last Friday. So trying to listen to feedback that we've gotten through the process and making these changes. Okay, so then amendment number 9. It's the employment services.
I think that is, I was using my cheat sheet over here, is that 14C?
Okay, the primary change, so I introduced a amendment on employment service to fully restore the employment services that have been cut and paid for it in a variety of different ways. So I'm changing the pay-fors, so it's the same, it's still fully, like I say, I fully funded it when I introduced it, and this is a change in pay-for. And again, this is looking at getting feedback I received and also looking at other amendments that have been dropped. So the pay-for now is, and again, looking at others, what others have sort of put on the table, using chairs or revenue amendment number 1, also number 3 and 4. Also, and I think this one coincides with Commissioner Jones-Dixon, safety on the streets. And then I've reduced rather significantly the vector control relocation project. I mean, I think I had $1 million last time, and it's now down to 273. And I also used vacancy savings, a pretty significant vacancy savings. And again, I'll be talking about that more later, but I backed that out. And again, trying to look at where it seemed like other people were spending the money to maybe try and get the duplicative spend down. I think it's 3. Okay, the last one is amendment number 2. It's the senior legal assistance.
Countywide number 5.
Okay. And I'm changing the pay-for. So this is a restoration of 3 senior legal assistants. They're local 88 positions, and I had paid for it with the chair's office, or the elected leaders transition, which I still believe is a very, waiting for additional information, but I think it's a number more than we needed just based on past history. But I'm going to remove that and instead pay for it of $386,000 out of the COO DCM director's office. And this goes to my earlier discussions when we had last week the COO DCM office, that there's been a pretty a very large increase since 2019 in that office at probably some of the highest pay in the county, and that and just to be consistent from past years, so a reduction in that. Again, over the last 6 years, they've probably seen the largest percentage increase in the county, would be my guess. So I'm taking it from there. And that's it, sorry. Again, trying to narrow some of the differences and respond to feedback from commission offices, staff, the budget office.
Thank you, Commissioner. Thank you for the level of detail, too. It's very helpful.
Awaiting, the health department has the largest number of vacancies, so I'm waiting for some information on that I've requested, and I'm sure I'll have some additional changes based on that.
Before we move into discussion, are there any other updates that folks have to share at this time?
Yes.
Okay,
Just for Amendment 33, the Greater Portland Inc., I want to withdraw that amendment, seeing that it was included in the chair's budget. Formally withdraw. Thank you. 30,000 more.
Just kidding.
Good start. Great start. Good start.
This is just a logistics issue. So the spreadsheets you gave us all have like tabs with our numbers. Since you have access to everybody's, are you going in and putting the county number in so like we can continue to?
That is, yeah, so everybody's that I have access to, I've gone in and put the countywide number in there, just because you can see where the culmination of all of this is a little bit of work to get that together. So I had sent them to your staff and asked them if they would put those countywide numbers in your document so that you had them, but happy to go through and provide that to Michelle and Brian so they can do that.
And then what the external world has as well is like, will be the countywide numbers.
So right now they have, on this sheet, it's just the countywide numbers because it makes the numbering make sense and it makes it easy for reference. On the amendment packets themselves, it has both numbers. So, and again, this was an experimentation with a new process with the board. So you can see on them that it has the commissioner amendment number so that in your spreadsheets, you have your tabs. I have renumbered them so I can make the PDFs. And then underneath it, it has the countywide amendment number so that in bold, so that they can then track along with this sheet here. So trying to preserve both so that internally you can use your numbering system and then externally we can use the countywide system.
okay, any other questions for Christian or Jeff? All right, thank you so much.
No, I do.
Oh, I'm sorry, Commissioner Moore, go
This
ahead.
returns to my earlier question on, what amendment number is it? It is 24. To restore 4 positions at $655,000. Can I get clarity from the department if they have subtracted the amount those positions bill for in that costing, or that is already taken into account?
I believe the costing that I received was for the full position, but we will verify that with the department. Have them
Okay,
come
and I
back.
believe 3 out of the 4 bill.
Okay. And they're, I'm calling up the health department next, so you can ask them. Yeah.
So
Asked for this for 3 months.
this is a larger, just wondering, the eviction money that's coming from the city, is that coming into this year's budget or next year's budget?
Sorry, say that again, which money from the city? All the money? No.
The eviction, the 5 million?
Oh, that's coming in FY '26.
Can I expand on that?
Yes, go
Okay.
ahead.
So what I heard yesterday, we were waiting for some numbers, is that, and please do not hold me to this number because it was just that in current year, fiscal year 2026, this is always where it gets a little messy, that we would be able to spend approximately $500,000 of the $5 million. So we would need to do a bud mod to accept that $500,000 fairly quickly. And then we would need to also add one more amendment to this sheet to add the $4.5 million that is the balance of that $5 million. So it's a both and, Commissioner?
That's what I was just wondering, like, where would it appear? Is there anything else?
I just learned about it yesterday as I was walking out the door, actually.
It's real time. Is there anything else that's coming from the city that we anticipate either for this year or next year?
So there are conversations around the dollars that the city has historically used to pay completely for sobering services in Multnomah County, which is $1.9 million. So the mayor has put $1 million for sobering in his budget. I know I am having conversations with city council members about the need for an additional $0.9 million to match what we have been planning on based on previous conversations with the city. And so $1 million and potentially more based on potential amendments that may come forward.
And so that would, do you think we'd know before the end of this fiscal year?
Yes, when they pass their budget, we'll know,
So,
but maybe not when we pass our budget.
They're going to pass their budget after we pass our budget, so there's a little bit of a timing difference there.
one thing to note, it's like they actually owe us 100,000 less because yesterday they took 100,000 off their permitting costs for us.
They didn't pay us this year.
Yeah,
I know, I'm just saying.
We gave them a $1.9 million discount this year.
yeah.
So that would be, so the potential sobering, that would be the potential, whatever, 800 to 900,000, that would be additional, but, so there's nothing else in there?
I don't know if it's additional or not, and again, I know we have the health department here, but there has been some assumption of dollars that would be coming over from the city for that, so I don't know what the net would be depending on what the city actually brings over, or actually allocates in their budget. And we can ask that from the health department when they come up. But so there may already be assumption of dollars in the budget, which,
Okay. For whoever's testifying in the health department, it'd be great to know that when you get up here. And that's it, though. Between those two things, like all the things they did, that would be the,
I mean, there are always dollars that we have with the city. I think those are the major ones, I would say. I mean, obviously, depending on the timing of vector control, that is a conversation that we would have about the city's commitment around vector control dollars would potentially be coming over. Those are the main ones, though.
so in the vector control, they would actually send us their dollars? That's how it works?
Right, because it's for a replacement of our need for facilities for that. And so that's part of the agreement that we have been talking about with them. But the timing of that is a little bit up in the air right now.
Okay.
All right, great. Well, thank you, Christian and Jeff.
Fantastic.
Yes.
We'll get it reorganized and out to you as quick as possible after the work session today and get it back up on our website with the changes that are here. In the meantime, again, if you see anything that I have missed or misrepresented, please let me know. I want to make sure that the record is accurate and that everybody's working from the most accurate information they have.
This is really great to have all of the amendments printed out and labeled as they are, and then being able to match it up with the overall spreadsheet. So thank you. You guys have great.
So just for clarity, and I'm sorry because I dropped a lot of it, which changes the impact statement. So those will be updated. Yeah, okay.
We'll move as fast as possible on those as well. I hope everyone's listening. And again, as soon as we can get back and just get everything moving, we'll get that updated. And then Commissioner, if we have a number for the eviction prevention dollars that would go in that other funds, again, just making sure that we're accurately portraying what the totality of the amendment looks like, and then the information on that would be, I would like to get that updated in this next round as well if we have that information.
Okay, so that, anything for Moyer's amendments that would have an offset, Singleton, all right, and then updates for that. Okay, thank you very much. All right, so now, as I said, we have the Health Department and Homeless Services Department here today for follow-up questions from the board based on interest from commissioners to bring those departments back, so I would invite the health department to come on down, and we've already heard a couple questions this morning.
Can I just ask a question? We're not having this discussion, maybe I missed it in the preview.
So we're having the departments come down first for the follow-up questions. You had asked for the health department to come and for some follow-up questions, and so we invited them back this morning, and then once everybody has their follow-up questions answered, then we were going to start talking through the amendments
Okay.
and in the order that board staff had put together. Good morning, Health Department. Partial Health Department, we have more people in. No, I mean, come up as needed. There's way more of you than chairs, so.
I'll do a parade. Good morning. For the record, my name is Rachel Banks. I'm your Health Department Director. I use she, her, and her pronouns. We are here today to address some questions that we got yesterday afternoon from Commissioner Brim Edwards, and then, of course, anything anybody else wants to know. We will undoubtedly need to do some follow-up, just in terms of time to get the questions fully answered. Happy to do that. But what we're proposing to discuss today are the questions that we got around vector control as it relates to Maywood Park, some questions around mental health court, and we'll start, and then a question around corrections health. And then, of course, we have the vacancy information that we'll be following up with. So we'll start with Kirsten.
Good morning.
Hello, good morning. Kirsten Aird, she, her pronouns, Public Health Director. So the question around Maywood Park is the one that I'm starting with, and then you could ask me whatever else. But what I understand about the agreement, we had an agreement a few years back that had been long-running, was for about $1,500. And in that, we did all of their code enforcement for health. So chickens, complaints about garbage, things like that. That's separate from what we do with health licensing, right? For $1,500. Ding, ding, ding. It costs more than that. So we canceled the agreement, started to renegotiate. We didn't get anywhere on the renegotiations because they were asking us to do all of their code enforcement, especially trees, which doesn't follow under health enforcement. So that was a hard no for us. We had something in place for a little bit. The team has not yet gotten back to me the exact amount. We were working on some of the health enforcements, again, chickens, garbage. That stopped. We now are trying to do an hourly rate, which shocks them on how expensive it is. But our code enforcement, we have one code enforcement employee who is sanctioned by the Sheriff's Department. He's been here for 42 years, very tenured, very experienced, and is paid what he is worth. So in calculating that, we just haven't been able to land on an agreement with the amount, and they still want us to do the tree code, and we can't do the tree code. It's just not within health work that we do. So we don't have anything right now, and I think that's the latest that I can tell you. Again, I did ask for a few more details. We do about 3 or 4. There's not like we do a ton of work out there, but we do a handful of visits that we get called into, or we were doing. Is that helpful? Get you more information? And then again, I did ask for a bit more detail, and I don't have that quite yet this morning.
Thank you.
This is more a broader question. Do the other smaller cities contract with Gresham for their code enforcement, or do themselves?
It
Do you know?
varies and depends.
The county doesn't do it.
Yeah, not unless we have an agreement with them to do that.
but do we have an agreement to?
There might be some, I have to follow up. I want to say, I think there might be another city, but I don't want to promise that until I confirm.
Okay, thank you. Other questions for the Health Department?
So I had a question around the resolution and the action that the commission took on the, on deflection, that in addition to the criteria, there were a host of other things around integrating other services. And this may be for the health department, but it may also be for their or other departments. Since we took that action, I think February 26th, are those things embedded that the commission approved? Are they embedded in the chair's budget?
I'm sorry.
So, so my question is about deflection, so.
Could you clarify, like, what part is embedded in, like, what specific?
So this goes back to, there was two main parts to deflection, and there may be your lifeline coming up here right now. And one of them was the success criteria, which gets sent to CJC and it gets approved, and that's why, like, when defining whether somebody has successfully completed deflection. It was a 7-page resolution. There was a lot of other things in the resolution, which was around effectively integrating other county resources and supports for individuals who came to the deflection center that didn't have anything to do necessarily with the success criteria. But it was very clearly laid out. And the question is, some of them were like people, some of them would have been contract related. And the question is, are those things embedded in this budget that we're about ready to pass? And the reason I'm asking, I don't want to ask in July and be like, well, the budget didn't have that in there, so we're not actually doing it.
So maybe I'll jump in. For the record, Justin Black, he, him pronouns, Deputy COO. So I think you're talking about like the integration with HMIS to make sure that folks are getting connected to those services as well. Additional work with, the Behavioral Health Department and DCJ on making those connections. Yes, that is all happening in there. Even the progressive touches with individuals as they come into deflection for the 90 days, that's in there so that the current staff are doing that work to make sure they're having those connections. I think I have asked for some additional clarifications on your questions around how that connects to treatment. So I'm getting the back to you, but yeah, so that the basics of that integration of additional services are built into this budget.
Okay, so, and I can also follow up after here and just like show you the specific parts of the resolution. And the reason I'm asking, and again, I don't want to ask, and it's a horrible thing for a commissioner to ask a question in July. It's like, it's bad for staff, it's bad for the commissioner. Like, oh, wait, that wasn't in there. So like, now's the time if we need to make some adjustment to do that. So that's why I'm asking the question before we adopt the budget. So if there's something that's not working, so we can, maybe you and I can follow up just to go through it to make sure that, I mean, if it's all covered in the budget, the implementation, that's great. I mean, and if not, then I'd want to know, like, what do we need to do before we pass the budget?
Yeah, and if you want to dive into some of the details on how that's delivered, I think Health Department and I are happy to do that. And yeah, just send me that specific part of the resolution and we can have a deeper conversation about it.
And then contract with the provider, the current provider, but also the transitioning provider is adequate to cover the additional requirements that are in deflection now? So before it was like you had to engage with one service, and now we're,
So
meaningful engagement with 5 services over 90 days. So it's.
Yeah, So I think on the engagement with the folks, I'm going to call out one piece that's not quite there, which is the transportation piece. So there's a couple pieces in the resolution around transportation. My understanding, and Anthony will correct me if I'm wrong, is the new vendor does have a little more capacity to do transportation. The specific one that we're struggling with is that transportation from in the field to deflection. So if someone is stopped in either downtown or in Gresham, one of the barriers we've seen in getting folks in there is that that transportation to the Pathway Center. We've been having conversations, at kind of a staff level with the city of, this is one of those reasons why we need that funding from the city at the full 1.9 is there isn't enough budget in there to do all of the transportation pieces. And I will say that all of these things are in the budget. How far they expand out is really dependent on some of this additional funding from the city. Just like the health department had to come back and do the Bud Mod this year, they weren't able to expand to all of the things that really help make deflection work because there are some financial constraints. And so sometimes it's a magnitude of, yeah, they can do this, but they could do it so much better with some additional resources and some additional connections.
Wasn't quite what I was asking, but it has led to another question. So when the Pathway Center first opened, they were bringing through Portland Street Response and CHAT, which are both city services, as potential shuttlers to there. Are they bringing anybody there? Or is that was just the conversation still going, or is it actually happening?
So my understanding is PSR has brought a few people into deflection. They've had some difficulties in how they do that transportation. At times, they've even had to. They've had some difficulties in how they get folks in there. I've had additional conversations with Stephanie Howard and others at the city about doing another, for some reason we coined it a career day, of bringing PSR and CHAT and other providers back in with the new provider to do more information sharing and collaboration on how that partnership can be stronger and how the new provider may be able to help with some of the transportation. So I think it's something that has a lot of puts and takes along the process. And so, the behavioral health team has been working with PSR and others to make that work.
Okay. I'll have some follow-up on that as well. My question, I think that I was trying to assess, let me try and clarify, was last year, the success criteria for deflection was 30 days and accessing a service. The success criteria has been changed to an assessment and five meaningful engagement with 5 services over the 90 days. So my question is, and this wouldn't be Turk House, it's the new contractor, is their contract adequate, the size for the number of people we're anticipating coming, to be able to support the expanded engagement that's expected in the success criteria? So instead of 1, it's now 5, and it's 5 with meaningful engagement with treatment-related services. I'm seeing some nodding, but.
Anthony Jordan, Interim Director for Behavioral Health. The CBI, the new provider, they have a different model than Turk House. So they do community-based, so they go out into the field. So I think we would be able to meet those requirements that you're talking about based upon their model. Is totally different from Turk House. So I don't see what we would run into unless we get large numbers of people, then we would have to evaluate that. But I don't see any concerns about meeting what you are asking now, as of now.
Again, what I just want to make sure is, like, I don't want to pass a budget that, like, well, actually, they only have enough capacity to do 2 meaningful engagements. That's what I'm trying to get at. So
Yeah, and so, and I would just say, so this morning I sent a question to the health department, just really outlining on, you're referring to 2B of the resolution, and, how that, 5 or more, care coordination contacts within 90 days with progressive milestones at 30, 60 days, coordinating treatment services across county departments and external service departments. How is that being implemented? So we'll get that information back to you.
Yeah, it's implemented, but for this discussion, just want to make sure that it's actually funded.
Yes, and I want to be very specific about that. That is
okay.
it is that 2B portion that you're talking about, correct? That is that progressive 5 contacts.
Right, it's just very different from, you have to do one thing in 30 days. And I'm assuming that is going to be require additional capacity, and then we have to pay for that capacity. So I'm just wanting to make sure that we have in this budget the ability to, like, we've projected, here's how many people are going to be coming into deflection. And based on the new criteria, it's somewhat of a formula, here's what we think that would cost. And that maybe because they have a new model, the cost doesn't increase, but I just want to make sure that we have that versus like, hey, we only paid for 2.
Yeah.
So now maybe let's move into, you had some questions about mental health court and the POs there. So we have Anthony and Jay here to talk about that.
Good day, Chair, Commissioners. Jay Alsander, interim Deputy Director with the Behavioral Health Division. So I could speak about mental health court. Mental health court has been funded. It's a project that has several court partners, including the court, the District Attorney's Office, Metropolitan Defenders, and Department of Community Justice. And it supervises 80 individuals through the DCJ who have a specialized probation and are supported by the mental health court. We have, in the Behavioral Health Division, funded 5 positions historically in FY26. That has been reduced to 2 in FY27, while the other 3 FTE have been planned for other activities that are required in the CFA. Mainly, these are jail diversion activities, pre-adjudication. And so the metrics in our new CFA require that we work with individuals prior to being sentenced, in addition to we're allowed to work with individuals in the mental health court. There was a decrease in not the staffing overall for the program offer. However, 3 of those staff did move. Our plan was to move 3 from the mental health court to do the other activities that are required in the CFA. At the same time, there was a question about the 0.7 FTE reduction. That was somewhat unrelated. That is an executive specialist position that supports the senior management team that was reduced. And that will not have an effect on services in this program offer.
So I was the person who asked this question, and I may potentially have an amendment from just talking to the mental health court judge. Going from 5 to 2 basically makes the program not work, and would reduce the number of individuals they'd be able to serve, and likely impact their grant funding that they get just because of the reduction. So it kind of maybe an unintended consequence. I think generally the county has been supportive of mental health court, just as a positive way for people to get support as they're, in some cases, moving through the justice system. So I'm not saying it was intentional at all, but it is having an impact that may actually reduce pretty significantly the number of people who could actually access that service and get the supports they need. And understanding why, because of the CFA requirements and everything, why the changes were made.
Absolutely, and we would love to support the mental health court as much as we can spare. Our plan to mitigate the potential reductions would be to to look at each partner and where is the overlap happening and how can we really coordinate more effectively, efficiently, reduce overlap, and in particular, rely on our community treatment partners with the Medicaid, who provide Medicaid billable services to do the treatment portion, while our team can focus on the episodic need of individuals who really need that more court coordination and care coordination to be linked and securely linked with the system. So it's not ideal to have less staff, of course, and we'd love to have more. Our plan, though, is to really to rely on the court team and to not see any reductions to their grant or to their numbers served.
So I'm curious, has there been conversations with it? Because it didn't sound like it was somewhat of a surprise. I mean, to the courts about the change, has there been that conversation?
Yes, we've had multiple conversations. It's, the CFA has mental health court as an allowable service. However, it doesn't meet any of the metrics for jail diversion, which has historically funded 100% of our involvement in the mental health court. So we would love to do both.
So I think, and I'm just trying to understand, that I heard you say is that there have been conversations with the courts and that you don't think there's going to be a reduction in services, but they believe there will be. So maybe this is a longer a conversation outside this room of like, how is it they're saying one thing and the county is thinking that there's not going to be a reduction? So just maybe squaring up with what we think the outcomes will be with what the courts do, so that we're in alignment on the outcome and nobody's surprised. Because right now, the belief was with just 2 individuals, going from 5 to 2, that there will be a significant reduction in the ability to serve people.
Yes, and we have had these conversations with the wonderful Judge Waller, and
Okay.
our goal would be
I'll
not to have
follow up
any
afterwards
reductions.
because I've
Absolutely.
had conversations this week and I want to make sure that we have an agreement again before we pass the budget of what actually the outcome will be.
Absolutely.
Thank you, Jay.
Of course.
You want to talk about CLP?
Oh, yes. I think the question was about how do we prioritize infrastructure. We do it in a few different ways. We look at the needs of the community through a variety of different ways, through any kind of reporting from the state or the CCOs, or any other type of feedback we get from our community partners, like wait lists or any of those type of things. And we use that as a metric that there may be a need in the community. And then what we do is that we try to understand if there is a need. Is there a funding stream that's going to support ongoing operational costs? Sometimes we build things for a need, but we don't have the funding to sustain those. And then since we did the CLP, let's say in the last year, there has been some capacity building for mental health residential. A lot of the facilities that was licensed for disability for DD services, they actually are getting licensed as mental health facilities. So it's increased capacity to sort of provide mental health residential programs.
I've been listening, but I was looking for the email that I had sent last year, and I'm not finding it right now, but if other people have questions, I'll find it in a minute. Because it was when we adopted the comprehensive local mental health plan, that there was a statement that the most important, one of the highest priorities was critical infrastructure, implying like facility related. And then when I followed up and asked for it, I've asked what it was, there wasn't a list, and it implied a list, but I can find it.
Yes.
The email in just a minute.
There was a list that OHA put out of the different infrastructure needed for residential services, and a lot of, I think the governor put out some funding for those residential programs. Some of those things are coming online. I think when we did the CLP, we were talking, it was a moment in time. I think that there is infrastructure need, but I think when we did the CLP at that time, there is some critical infrastructure that's needed, and it was really coming from that list that you were talking about. And we was looking for that list today because it was like, where's this list at? But
We'll
it
follow
was.
up with the list.
Huh?
Yeah,
Okay, we'll do that, yes, we.
I do think it's important to know that when the state licenses a residential treatment facility, and almost everybody in mental health court is going to go to it will use a T and not a C. Residential care is in long-term care, and residential treatment is under OHP, kind of. It's complicated, but those placements are not exclusively for our county. And so I really discourage people from looking at what the state did around capacity and thinking, oh, well, we've got X number of beds here, that means we're great, because we don't actually have access to placing most of those. Those are almost all Psychiatric Security Review Board, which is individuals who are found guilty except for insanity. And yes, we can, but we are also competing with parts of the state that don't have. So I get really nervous when people want to use that as a benchmark of like, we've added so much. Not that we can use, really. Some, not none, but I do think it's important to like not use that as a benchmark because it's not really available in the way that like a mental health court might need it.
We 100% agree. Yeah, we was really answering the capacity, like what the needs were, but it doesn't necessarily grant us what we put our people in. So we 100%.
For Commissioner Moore, yeah, so I found my thing. It's in the CLP on page 69, there's a statement that says, our most urgent high-impact gap based on the assessment listed on pages 60 to 64, this document is improving behavioral health and SUD facility capacity. And so my question then, again, and this is like informing sort of like next year's planning, is like what are those, what investments in the physical infrastructure were we referencing in the CLP? And are we doing anything in this year's upcoming budget related to that?
I think if the reference, I think you're looking at is the reference that OHSU put out, that SUD gap analysis, where they said they broke down different counties and what the needs for those services. And I think that what you're referencing, I remember that.
I mean, I can forward this. This is from January.
Yeah.
But I mean, literally, this is what we had in our CLP. Our most urgent high-impact gap, based on the assessment, is improving behavioral health and SUD facility capacity.
Mm-hmm. That's what I'm saying, that we're citing that report. And I think one of the ways that we're doing it, we are building the permanent facility, which, if I remember that report correctly, withdrawal management was one of the services, one of the facilities that was needed. And then there was some, I think, women residential services that was needed. And I can't remember the full report, but it was broken down into different counties. And I can get back to you with that information. But I think that is what we were referencing. I'll make sure I verify that when I leave, but that's what we were referencing.
So I did follow up after that meeting, and I got somewhat of I didn't get a list. And, you know, I'm concerned if that was our highest need, and so for even the withdrawal management beds are not slated in the permanent sobering and crisis stabilization center, aren't going to come online till November of 2028. So again, focusing on that, what the gap is, so we know what it is.
Yeah, I mean,
and what steps should we be taking to
One of the things that you bring up is a good point, and I think we have heard from our residential as well as withdrawal management. Sometimes the issue is not the acute services, that's the main issue, is like, it's really what happens after they leave those. Just having a convening of those residential and withdrawal management programs when we went to the CLP, is that they're keeping people in those acute services longer because they can't get people to that next level of care. So sometimes people
Recovery
focus.
housing or something like that?
Yes, correct.
I guess I'm trying to get, like, what is it so that we can identify as we're like approving our budget and services that we've identified what the gap is?
Okay.
I did. It was several pages, and we might need to talk about what it might cost. I like to believe our friends at OHSU have like done that and can just give it to us. But I think that's a really good point about, because even the one that the state did is dated at this point. I think there is a real need to relook at capacity but one of the things that I agree with, and I am hoping from the budget note, is that we go from having all these standalone services, which is what the SUD system is. They know each other, they work together a lot, but it's not, we aren't being able to help people flow through in the way that I think we envisioned for deflection, that we help people go from step A to step B, and when there is a little gap, that we have plans to keep people in a sober, safe environment through that. And I think that we've got work to do on that, and it's unfortunate. I would have hoped that since many of those services, not all, are Medicaid funded, that our CCO might have wanted to have a system of care, but they don't.
Certainly agree, and with everything that's been said, and particularly around the need for the systems-wide strategies that connect the dots. There's several places in this budget that take a step to get us there. One of them is the CLP work, right, and our support of that. There's also been, over the past couple years, additional epidemiological capacity added specifically for behavioral health that can look at some of the data across systems, the population health outcomes. Right now, I think there's, good data capacity programmatically, or folks do it each individually within their areas, but being able to bring that together is one of those system-wide strategies, being able to move towards more dynamic modeling. What happens if we invest this much here? What does that do to this part of the system? Where are the actual gaps? How are people flowing through? This also will be some of the core work of the behavioral health officer, of pulling people together, working with those epidemiologists, doing our next round of needs assessment and planning, including with the CCOs, our other health system partners, and really playing that role of convener and also system architect, if you will. It's not everything that we need to get to that, clearly, and we need other partners, but those are kind of three of the investments that are in here in this budget, as well as increased capacity for policy, specific behavioral health policy and legislative support. I know that that's something that you all have spoke about, and working with our state partners and other folks to really understand what are the either big P policy or some of the programmatic administrative barriers, whether it's in Medicaid or other areas that we need the state's help with to help us unlock. So those are kind of some of the 4 areas that get to that system-wide work that you'll see in this budget.
So just tying a bow up, we said in the CLP that was a critical need, but we don't yet have a list of what that physical infrastructure is.
Sounds like there's a couple lists. There's the OHSU one, which we'll definitely get back, as well as the OHA one. The year some of the data that we were using, which, as Anthony said, was point in time for the CLP, which dragged on a little bit longer than we thought, was based on some investments that this board gave us in doing a capacity analysis, which took the state's data and looked at what that looked like here in Multnomah County, both, so it localized it and it also updated it in terms of a point in time. That was the CAST analysis, certainly far from perfect, but we can also, send that. But I think those are the three sorts of lists that we can follow up with and are probably referenced in the.
If you could send me whatever you think is the best list that fits that category of what we described in our CLP as like the critical infrastructure that we wanted to get after. It's just like, I want to know what it is we're trying to get after. And whether, like, if we got after it and we're successful, whether that actually addresses a lot of the issues we had.
Yeah, definitely. I think one of the things, too, that'll be important as we follow up and talk about that is who the "we" is. So our CLP was doing a, kind of needs assessment of what the community needs, and there's, it's Commissioner Moyer's point, different "we's" in there, and so us kind of being able to have a conversation of like, this is where we see the biggest need is, here's where we think the "we" is the local mental health authority, here's the "we" is the community mental health program, here's the "we" is in the state support, here's the "we" is in CCOs or other health systems will be important part of that conversation, I think, to answer your question, which is, all right, what's the gap so we can move about filling it?
And this is all being done in the coordinate, because so much of this lives in the homeless response system plan as well when it comes to some of the overlap that we're talking about with HealthShare. We reviewed a bunch of the capacity data, and this, I don't know what they've got, but I really want to play with it, that you can do different levers and see where there's different capacity needs. So all of this is being done in coordinate. I just want to make sure we're not siloing some of this work off.
We do have areas of coordination. I think there's a lot more opportunity. It's one of the things I get most excited about in this next year and moving forward is having the right capacity to do the coordination and to do the dot connecting. So, there's some, but I won't say it's what I would consider the full scale of what we can actually maximize under our one county approach. But I think it's one of the most promising things that we have in the next year and the most exciting. And so our budget has additional resources in it to have folks that is their job, that they are doing that, along with the folks that are working day to day in the programs and working with their colleagues. But that specific capacity for data and EPI and systems connections.
Thank you.
Yeah, thank you for your vision around it. Follow-up.
I have a follow-up. If you want to switch topics, I can also wait.
Go ahead.
But I was just like, I got answers. So, Enrique.
We love answers.
Sometimes. I think this is an okay answer. I think this
Let's take an answer.
is a good answer.
I may not agree with it.
So we don't do any other work like we do with Maywood or did with Maywood in small cities. We do with Portland. It's the exact same amount. We charge $250 an hour. And on average with Maywood over the last 2 decades, before we stopped, we did around 11 visits a year. It's about, if you apply the $250 to that, it's about 5 hours a case. It's about $14,000 a year on average, but we're looking at a contract that would have a cap, so it would be bigger than that if something goes to court or they end up having, like their peak year, there were 35 things that we did for them. So that's kind of the range of what we would be looking at for a contract, but we are on pause right now. That information has been shared with their mayor and leadership.
And that's just the Health Department code enforcement?
Right, that's just health enforcement. Yeah,
Not
we
the-
can't do the other stuff.
Not the trees.
Yes, we can't do the trees. Not that I don't love trees, but we can't do the trees.
They have trees right in the middle of their roundabouts. It's the weirdest thing. Thank you. Do other people have questions? Because I'm going to just finish off on the vacancies, and I know that I haven't gotten it yet, but.
Go for it.
Okay. So the health department has, I think, the largest number of vacancies. 189, both general fund and other funds, I believe is correct. I'm pretty sure, yeah, that's a nod. Okay, so 109 vacancies, and I asked last Friday for the length of time of those vacancies, both general fund and other fund. And I asked for two reasons. One, obviously, if we have a vacant position, and if it's a direct service position, say it's one of our clinics, like those are dentist appointments or doctor's appointment, like a whole host of things that aren't happening because the position is vacant. So just a concern about a pretty long list of positions that are vacant. And then also the length of time that they've been vacant. So if in my past professional life, sometimes when a position is vacant for a long period of time, it can be because of a number of things. It could be like hard to fill, like looking for a really specific expertise, or it could be just like, this is a lower priority. So I'd like to see that. Also, before I did something related to vacancy savings that were in, like capturing any savings from like a delayed start. I know Commissioner Singleton has, I think, a 6-month delayed start. But like, are those positions that like just recently became vacant and like high priority to get them refilled? And so wanted to get a better understanding of what the vacancies look like, where something's been sitting there for, a year, like is another 3 months going to matter? So that's why I'm interested in the list. And based on our conversation yesterday, it sounds like there's a couple different reasons or rationales why they still may be vacant. They may be being held for Project Save or a host of other things, or it just opened up and we're trying to fill it. So I'm interested in that, not wanting to just make assumptions about where the health department is, but I say was concerned just looking at the categories of vacancies, and because of a lot of them are direct service positions.
Yeah, a couple thoughts. Definitely we'll get that back to you. And after our conversation yesterday, went back to my team and said, this isn't just general fund, it's all vacancies. So we're working on expanding that list and getting the information for all vacancies, which was kind of to that expanded ask. A couple of things just that we chatted about, but also for everyone else's awareness. In terms of when we first did our budget development process, one of the things that we looked at was those long-term vacancies, both from a service perspective and also just a reductions perspective. So whereby there was long-term vacancies that either were hard to fill, or we determined there was another way to deliver the service, we looked at those first blush in the budget development and eliminated some of those longer-term vacancies that we didn't feel like were necessary, or we needed to mobilize a different strategy. The other thing I would say is that most of the vacancies are in our integrated clinical services area. So that's the enterprise fund, kind of not the general fund piece that has financial implications, but doesn't fully address the service implications that you're talking about. But just wanted to note that. In terms of some of the positions or the area types that are harder to fill, we do have some categories, particularly in dental and some of the suite of dental positions that are harder to fill. And our phenomenal recruitment team has specialized a variety of strategies, whether that's going out to schools, creating pipeline programs for folks to get in, a variety of different things there, but dental hygienists, dental assistants, dentists, that sort of things. And then there are particular sometimes challenges with just clinical positions, physicians, nurse practitioners, psychiatric nurse practitioners, that ebb and flow would have to do with market forces, salary, a variety of different things that we've just seen, in health over time. The majority of our vacancies are, again, in the integrated clinical services space. A lot of them are clinical In the general fund positions, I'm kind of going off the top of my head, some of the stuff that we chatted about yesterday, there really are limited, what I would consider true vacancies, and this does, I will admit, get a little bit wonky, but when we look at our vacancies, we're looking at overall vacancies, and then, kind of always do a number of passes underneath. One is, of that list that was a snapshot and a point of time, have some of those, were they in the recruitment pipeline? Has somebody been offered the job, or in the interview process, or some of that? So we look at that, as well as, particularly in this year, the Project Save, or knowing that, unfortunately, there are a lot of impacted positions and employees in certain classifications. So we also look at that, where there are areas where our HR teams are diligently working to place people that may have been, their other positions may have been eliminated. So there's, much less in just the general fund vacancies in terms of true vacancies that are either new or, recently vacated or are not in the recruitment pipeline in some way.
Forward to seeing the list and having a further discussion about that. But what I did, the amendments I laid down this morning, in terms of the vacancies, didn't have, sort of excluded the health department from that, just waiting for the list. I have just one last question. And this will get back to sort of a conversation we had earlier. The positions that supported the Preschool for All that are slated to be for layoffs or be eliminated, I think there's like a dozen of them. What is the criteria the health department uses to make the determination? Like we have a service that's needed, say another department, in this case, DCHS, that has asked for, like, we need these services for Preschool for All. What is the criteria that you all use when you decide, like, we're going to contract that out versus using county health department? Because in this case, we're eliminating positions, county positions, and shifting to an outsider provider contract. And maybe share with me the criteria that you use, or do you have written criteria somewhere that?
Yeah, so I think that's actually a question for DCHS, because they're the ones who made the decision to make this change in how these services were going to be filled for next year. So we can invite them to come up.
Okay, I guess I can just ask, like, what is your criteria if the health department's not going to provide something? If you decide to use an outside contractor for something that had been provided by, because my understanding there's behavioral health services that DCHS is using, or is that decided by the department who wants the health department, the health-related services?
Yeah.
Okay. I guess DCHS knows what I'm going to ask them.
Yeah. Okay. Any other questions for the health department? Okay, Commissioner Moore?
Yeah, this is a follow-up to a request I've made over the last 3 months several times. Can I please get in direct services how much we are billing per program, and then how much general fund is needed to then fully fund the program? Because I looked at the program offers, and they're largely exactly the same as last year. So, so I'm just, and when I have a budget amendment, I'm being given the total cost, I think, of FTE, except they bill. And so that should be taken into account on that. So I keep asking for this because I'm trying to understand, where are we in getting to our billing? What is the match rate we're billing under? I think this isn't just a question for this year. I think as we move forward into other not awesome budget years, there are real questions about like, are certain strategies worth the squeeze? Like, CCBHC, going under that model is an enhanced match rate. Is it worth what I assume will be a lot of work to do that? And I think there are some other questions, I think a lot about the new Sobering and Crisis Stabilization Center, and like, are we setting that up in a way to maximize our billing capacity and other related issues? So I know I hope that that's not super hard to pull together, but it's really important, not just for this year's budget, but like strategically to think about options in front of the county around like, how do we preserve services?
Yeah, so I think a couple of things. One is we can get you the kind of forward direct services, what the total cost is, and then what the revenue is that we're bringing in. There are some caveats in there in terms of what you're getting at, I think, too, is what we could bill. And then the other thing is, I know kind of in some of the reports that are coming that are looking at CCBHC, other specific programs, where are the opportunities for increased billing? And then what would it take to get there? So I know that's coming too. So I think those two pieces together will help answer that.
I think that actually makes me ask an underlying question in how you budget. So is Medicaid billing going back into the specific program, or is it going into just a larger health department budget? So it's not necessarily, while it may be matched to that position, it doesn't necessarily go back into that program. How do you all handle that?
Yeah, I mean, I think the short answer is it goes back into the program. It's certainly the division. In our integrated clinical services, they must go back into that area, and that's largely the case in other places as well, is that it's going back into the program and the division, and it's budgeted as revenue for that service.
Thank you. I ask because as a former community mental health worker, that is not always the case for those agencies, and a lot of it goes into admin and executive salaries. So thank you.
I had one additional question. In the deflection resolution, there is develop a strategic plan for access with withdrawal management and treatment services. Is that also funded? Or do you need funding for that?
Could you repeat it?
That in the deflection, it says develop a resolution developing a strategic plan to for access to withdrawal management and treatment services. Is that, and maybe this is Justin can follow up with me afterwards.
I would say the short answer is yes, right? And there will be a number of people that work throughout the division and the department that are working on that, both in the deflection program in the larger department as well. That is a bucket of work that is categorized, that is accounted for in this budget. Yeah.
Okay, thank you so much, everyone from the health department who came up to help answer the questions on all aspects of the work that you guys are doing and plan to do for the next year. Appreciate you. All right, so we have Homeless Services Department in the house. And there, I would invite them down, unless, DCHS, unless you want to answer the one question that was for you real quick. Come on down. We'll just take care of that, right? Yeah. Okay. All right.
Do you want me to answer
Yes.
the question? So the question, Rachel Pearl, she, her pronouns, interim director for DCHS. So the criteria for making that shift?
Generally, if, currently there are county health department positions that support that. And my understanding is it's a different need. And the general question is, if we're shifting from something that's provided by the health department, I'm assuming it's not a short-term need, like, it's not all of a sudden that's going to go away. It's a longer-term need. Is like, what are the decision points or the criteria for shifting from county staff providing services, assuming it's the right service, to contracting it out?
Yeah, so there's a couple different situations that PFA will be navigating as it relates to making decisions on who provides the services. In this particular case that you're referring to, this is around program design, program need, provider and family feedback around the need. And it is not a criticism of the behavioral health team and their services that they provide. It's a different type of service that is provided by some behavioral health providers in the community. And that is the service that we need to have for the PFA model so that we aren't having duplication in services. And so that's how that decision was made through multiple efforts to see if there was opportunity for those to align, and they don't.
Do you think that's something long-term that the county would want to have internal capacity, or it'll be like, the county thinks it's better longer-term to have it be an external provider?
Did you want to say
So
something?
for the record, Justin Black, he, him pronouns, Deputy COO. I think for the specific need right now, I think the contracted out is better. I will say, DCHS Behavioral Health had conversations over a year to figure out if they could get this to align with the strengths of our internal program. And the program does not align for the need of the providers at the moment. That may change over time, but I think that this was not a quick decision. This is, I think, over a year long in the process of this. And to your other question about, is this a capacity that the county sees that it needs, I think that is a broader conversation probably with you all around the direction and how you want us to provide services.
Great, I think that is the answer I was looking for. And because it sounds like it's not a short-term need, it's a long-term need. It's a different need than what the current team can provide, so it's not like you can lift and move over.
And I would also say, I think it's a longer term conversation around, allocation of infrastructure inside the health department. I think one of the things, as we explore kind of all these conversations around Medicaid and billing and direct service, there is a need for expanded infrastructure inside the health department to do a lot of these direct services. I met with their billing folks the other day, and I think I even mentioned this at the dais the other day, is like, they are severely understaffed in that work, and they need a lot of back-end infrastructure built out, which will require the board to invest some dollars up front to build that, to get to a point where they can do some of this work. So it is a big kind of systems question and a systems investment conversation.
So when we, for example, use an outside contractor, they might have that infrastructure already and can just plug and play and can go ahead. Is that in play? And the county doesn't necessarily always have that infrastructure to support.
Correct. Because that is, with a lot of programs at the county, it was not built from the ground up to be a billing program and to deliver services in that way. A lot of times these programs were built to be low barrier, low friction, easy access into services, and that was the model that was built and was funded. If we are going to transition to a model that requires fidelity of program that can withstand a Medicaid audit, like, we have to build it differently. I think this is, I will say, a lot of the problems that the city of Portland is running into with PSR is they built it quick and they built it to do all these things, but you have to really get to that billing aspect and to get to that direct service, you really need to think with a different model and fund it in a different way.
Thank you, Rachel. Thank you, Justin. Okay, HSD, I see you all got ready to come down. Thank you so much.
Can I, because we were just talking about PFA, can I drop 2 budget notes?
Absolutely.
Let's do it.
Let's do it. Let's mix it up.
Let's wait. Okay, the first is budget note, I believe I'm on number 6. Sorry, department. That says, it is the policy of the board to ensure preschool for all rates cover true operating costs for PFA preschool classrooms. To that end, Preschool and Early Learning, PEL, will report to the board findings from the True Costs of Care study and compare that study with the FY27 PFA rates. This information will inform the board regarding the sufficiency of the FY27 provider rates and whether these rates need to be adjusted due to new information from the True Costs of Care study. PEL will report back to the board before August 15th, 2026. I got that date from them. It will be back. The second one, and yes, I did talk to Eric about this. This budget note requires the chair to direct the Department of County Management to explore options to reduce health insurance costs for Preschool for All providers in order to reduce overall personnel cost in PFA rates. The board requests a report from DCM regarding options including but not limited to pooled health insurance, association health plan, and PFA provider joining existing professional employee benefit association. The goal is to lower health insurance costs for PFA providers, which will reduce the cost of providing preschool to all 3 and 4-year-olds in Multnomah County. DCM will report back to the board before March 30th, 2026.
Okay, I think I'm going to have lots of questions about this. So yeah. Talk about it. Thank you, Commissioner. Okay, thank you, Commissioner, for these 2 budget notes. Okay, hi, hello, good morning.
Good morning. For the record, my name is Anna Plum. I use she and her pronouns, and I'm the Deputy Director for Multnomah County Homeless Services Department, and I'm joined by
Antoinette Payne, she, her pronouns, Finance Director, Homeless Services Department.
So we do not have prepared responses to specific questions. So we are here to answer questions that you have or provide context for questions that you may have. We do not have anything to lead with to prepare.
Great, well, I know some of the commissioners wanted to have some questions and conversation with you, so I'll open it up to the commissioners to have that. Are you getting yours ready?
I was going to let it go if you want to go first.
Okay.
I'll throw a couple out, but then other people can pepper in. One of the things I'm wondering is, in the past, employment services was part of the SHS budget, and it was removed, despite, I think, data showing that many people who have employment services programs, supports or engagement, like end up being housed at higher rates and maintaining that housing?
Yeah, so you are correct that we significantly reduced employment programs in our budget this fiscal year. And as we discussed in the work session, we actually reduced them the previous year as well. And this really has to do with the history of SHS funding in our department and the decisions that we're having to make right now to really focus on our core services. As a reminder, our budget was built around 3 core priorities that we developed in partnership with our providers, with our staff. We did a lot of engagement around the people we work with to really land on the priorities that we needed to guide our budget because of the amount of reduction that we had to take. We had to take a $68 million reduction in this budget. And in order to do that, we really had to make sure that we were focused on our core priorities. Those 3 priorities are, first, keeping people housed, second, prioritizing new housing placement, and third, maximizing shelter effectiveness, which means that folks are safe in shelter and they're exiting that shelter to housing.
We have a visual that was in our budget presentation that helped us kind of focus in on what we consider to be the things that are core to the Homeless Services Department, and those are really focused on housing placement and safety on and off the streets. Employment is absolutely crucial to people's lives, and it is something that we think that is important. It is just not something that the Homeless Services Department can support on their own, and we were in a position of choosing between employment programs or housing programs, and keeping more employment programs would have resulted in reductions to our core housing programs, and so we made the decision to reduce the employment programs instead. We do hope to work with HRS and other partners to figure out a way to support employment programs for the folks that we serve in the community, but with the reductions that we had to take, we simply couldn't use our budget alone to support all those programs.
I'm curious, did you look at, so there's different ways to help individuals either get into housing and stay in housing, and like obviously rent assistance is one way, but also someone having access to employment income is another way. I mean, rent assistance, it sort of falls into the category of like give somebody a fish versus teach somebody to fish. So I'm curious whether you looked at the trade-offs of like rent assistance being it can or it may or may not be a sustainable support versus like an employment.
So we look at the sustainability of our rental assistance by looking at people retaining their housing. So for example, we have two major housing programs. One of them is permanent supportive housing. That is for folks for whom employment is likely not an option, right? They need that long-term subsidy to stay in their housing. When looking at rapid rehousing, that is the program that is more short-term. It's up to 24 months, usually shorter. We look at the sustainability of that by whether or not folks are maintaining that housing at 6 months, 12 months, and 24 months after that subsidy ends. So once they are no longer receiving rent assistance, are they maintaining that housing? And at 24 months, we're in the high 80% for people retaining that housing. So that's how we think about the sustainability. One of the things that our case managers are doing when they are working with someone who is in a rapid rehousing placement is helping them identify a income source to help them maintain that rent moving forward. That could be employment, that could be a program like SSI, something with disability to help that person maintain that housing, and making sure they're finding housing that they can maintain with their anticipated income once the subsidy ends. So that is how we think about the retention. I do want to note of the employment programs that are in our budget, because there are some employment in our programs in our budget, we selected what to include based upon that set of priorities and our focus on racial equity as well. So we included our some of our culturally specific programs that are serving culturally specific employment programs, and then also our programs for youth. So we really tried to make sure that the programs that we selected were low barrier and culturally specific, so serving the most vulnerable folks who need that sort of income step up the most. That's how we selected what is in our budget.
So another question I would have is, for the rent assistance, remind me, is there a ramp down or is it a cliff?
So again, particularly for rapid rehousing, it's very individualized, but in a lot of cases, somebody will start paying back that rent over a series of months. They will know, for example, we think you have about 9 months of rent assistance, you're gonna pay X for the first 3 months, and then we're gonna start pulling that assistance back while you take on that cost. So it is an individualized plan per household, but it is common to have sort of a ramp down so folks can get accustomed to paying that rent over time.
Can you share the data with us, not this morning, but like of the rapid rehousing, how many individuals like actually do have a ramp down versus there's a cliff at the end?
I'll see what we can find to get you some information. Yeah.
Okay.
It's very provider specific, and I'm not sure that they are tracking like what at that level about per household, if it's a cliff or a ramp down, but we'll see what we can find to help give some more context to that question.
And then I'm seeing that Jillian's here as well, because I have a question that I think is more hers. And this is a request that I had asked at the joint city-county meeting. This goes back to the projections over time with the investments that are made. And I ask about, oh great, you have. Great. I was just bringing my, we'll see if it's the same thing, but I was like trying to describe what it was I was looking for, so just to frame up, since maybe we're in the same wavelength, but everybody else is like, what are they talking about? When we had the city and county meeting, I had asked about the charts that if we make X investment, here's what happens with the overall rates of homelessness projected into the future, and almost all of those projections showed it increasing. But the thing that, which is concerning, that we're not bending the curve with the money we have yet. The other question I had was, in the past, most of the charts that we received had, sorry, I'm a bad artist, but the top line was the number of homeless, and then the bottom line was unsheltered or sheltered homeless.
The dashboard charts, yeah.
And what I was looking for is like what happens with sort of the future projections with the reductions of our shelter and the motel vouchers. And you gave me a chart, which I did look like. It still shows an increase currently, but I'm wondering if you could put that in, because that's key performance indicator number 8.
Yep.
If you could put, so again, both of the lines show we're going to have increased numbers of unsheltered homeless, but also increased number of homeless. And I'm wondering if you could put that in the chart. And maybe it's here, but I just got it.
Yeah, you have Jillian Shoney, Director of the Homelessness Response System, she, her pronouns for the record. On that second page, okay, one of the handouts I just gave y'all is one of the original graphs you have seen about the projection. Oh, yeah, can you?
I thought these were all like.
All for you?
Okay. Those down.
There's just one copy.
Yeah, and then a copy of our May quarterly report that we just published this past Friday that I will send out electronically after this meeting. But as promised, that's the preliminary report where we just pulled the data through March of 2026 in the context of our 12 new KPIs and KEIs. So that is for your situational awareness at this moment, but certainly future use. And again, I'll email that out to you and your staff after this meeting. But before you, with this handout, you have this chart that you've seen prior. I want to revisit that today. And then on page 2, you have an updated unsheltered homelessness chart, the chart you don't like, updated in the context of the amendments that have been proposed. Now, here, but to answer your question, Commissioner.
Right, I think I'm looking for this data overlaid onto this like we've had in the past, because usually in the past we've had, here's the overall number and then here's the sheltered number.
Yeah, that's how the dashboard reports it out, sheltered, unsheltered, unknown, yep.
Right, but
Yep.
we've been reporting out, I want to say, for the last year or so,
Yep.
and including when we approved the numbers, a combined versus you have to go someplace else to look at it. I mean, I think you have the data
So,
here. It just needs to
yeah.
be put like graphed.
Well, what we will do is take each of these vertical bars and do sheltered versus unsheltered segment within them, and then we can draw an additional set of lines at the unsheltered number. So we will get that to you like literally right after this meeting.
Great. Like I say, I look through this and it looks like I mean, the data's here. It's just presented in a different way.
Yeah. And I won't go into why that is. But
I think
to
what
answer your
you're
core
suggesting-
question, in one fiscal year, there is no way to y'all to change how you're funding the system for outflow to beat inflow. So under all the scenarios before you that are actually in reality, part of your budget reality, the goal is just to start bending the curve. And all the scenarios you've been discussing to date do bend the curve. We're still not beating inflow, though.
I'm aware of
So-
that. What I'm been trying to get after is also, so I think there's two pieces. Yes, the top line is the most important line, because that is like, are people getting housed? How many people are homeless?
This black line, are you referring to the black line?
Yeah.
That's the worst-case scenario. That's fiscal year '26
Well, either,
continued.
any of them, the overarching number, but
Yeah.
there also is a principle, like, when people are in shelter, they have access to basic services, hopefully supportive services, and getting stabilized. A lot of people are much safer. And so the top line is important, but so is, I believe, the sheltered line. And that's what I'm trying not to lose. And actually, it's one of the key performance indicators that were approved. So that's just what I'm trying to
Right.
get. It's not dismissing the top line or saying anything about the level of it. It's like, I also want to know the impact, because we're being asked to approve a budget that takes 675 shelter units offline.
Right, but I want to be clear, unsheltered homelessness is largely also driven by inflow, not the cuts you are making to shelter in this fiscal year whatsoever.
So there's been, and this is another line of questioning, so there is the commitment that's been repeated that with the closure of the shelter units, that everybody will have like an individualized plan, a person-level plan, which I appreciate, because that's something I asked for and have a budget note about. One of the things that is being, that I'm hearing from providers now is a natural thing that's occurring is the open beds in shelters are actually not coming from people off the street, but more because of the need to place people from the shelters that are closing, that it's actually shelter-to-shelter moves versus, so intake from people who are on the street are going to be on the streets longer. And again, I'm just trying to understand the impacts of what that means. So if you're on the street and there's not a shelter bed, my guess is like you would have more likely have had an opportunity to get into shelter before most of the beds, just given the utilization rate of 92% approximately. You would have had a greater chance of getting into shelter, but now it's actually going to the shelters that are closing. It's just a shelter trend.
Yeah, so I think what Jillian and I are trying to illustrate is that larger picture of reducing that shelter footprint so that more folks can exit to housing, so that more folks are accessing shelter that way. You are correct, on a nightly basis, fewer people will be accessing shelter per night as there are few units. Absolutely, that is a challenge. We will be giving the next update to you all around the folks who are in shelters that are closing the end of this year on Friday. So you'll have some more details from us this Friday, sort of our bi-weekly cadence on that update. So we'll get that to you Friday. And we're hearing there is going to be a change in intake as we are having folks move between shelters, if that's the best option for them in this moment. So that is a challenge. The goal here is to shift so that we can work through that transition so that our shelter footprint matches what will help us have the amount of housing resource to start bending that curve overall. So it's a little bit of this is a transition phase to get us to that rebalanced system where folks are exiting shelter to housing at a rate that means more people are accessing that shelter as beds turn over.
The beds will serve more people because of the housing placement funds. The amendments present a different scenario then, so I don't want to miss that point. Like, we were on a real good trajectory and bending the curve. But as you will see in the updated chart under KPI number 8, when those scenarios now move from the proposed budget to the proposed plus the 7.8 million in additional prevention, like we showed y'all prior, it's the Singleton 2C. Right, that starts to bend the curve. That's the orange dotted line on the graph. When we layer in, calculate the impacts to that trajectory based on the amendments that are on the table, we go backwards in a big way because it totals $6.7 million cut from those housing placement buckets, which put us in a worse scenario when it comes to unsheltered homelessness compared to fiscal year '26. So
you
that
talk
is your
about-
challenge today.
Can you be specific about amendments? Which
Yes.
amendments do it?
So your amendment, your recovery housing amendment of a cost of $2.1 million that pulls from permanent housing placement funds. And then Commissioner Jones-Dixon, you have several amendments that pull another $4.6 million from those buckets of money.
Okay, so explain to me how someone experiencing homelessness who would be eligible for rapid rehousing, choosing recovery housing instead of a different setting.
It's not a permanent housing placement, that's the difference.
Yes, but
It's a
rapid
time-limited
rehousing
placement.
isn't, I like literally just had this conversation yesterday.
So we do, rapid rehousing is considered a permanent housing placement. So that is considered permanent housing. What Jillian is speaking to, we did add up the impacts of all the amendments that purport to draw from the placement out of shelter, $10 million one time only. And we did use that for yours because of the state funding identified not being eligible for that. So if you were to add up all the amendments that draw from that particular source, it's about $7 million. So that would reduce 539 people exiting from shelter into housing. So that proposed shelter exit rate that we were going for at 30% with that funding would be reduced to 23% if all of those amendments were to pass as of right now. So that's what Jillian's speaking to.
Okay.
To your point of, that is specifically those placements going from shelter into housing. And so that's part of the reason we're speaking to that impact is the way that we think about making sure that shelter is an effective pathway to housing in this transition year as we're reducing shelter. So that's why we're focusing there. I believe you were going to make the point that somebody would still be in recovery, would have access to housing. That's also positive. We're describing the impacts on the placement out of shelter as that's our number one sort of priority shift in this budget. So that's why it's described in that way.
Yeah, I don't want, I don't want us to chase a metric over chasing a better outcome for a human being. And I've talked to Metro about the metric, because for me, I get it. I want people to be placed out of shelter. But I also ideally want to set them up for long-term success. So if I have somebody either on the street or in a shelter who says, I'm ready to address my substance use disorder, and they go through detox, they go through inpatient, and then we hook them up with this rapid rehousing fund to recovery housing. Because they went through treatment first, we're going to say that's not a success. That's not a success. It didn't go from shelter to housing, except it is a better success for the individual. So for me, it's like, okay, and I've talked to Metro, so I get that, like, we need to change an outcome so it looks, it shows the success that it is. But to me, that's a ludicrous reflection in, like, well, outcomes are worse. They're not in shelter, or they were in shelter and they did treatment, and then they're housed, and we're gonna somehow say that made the situation worse. I'm not gonna speak to other people's amendments because I don't know the mechanics of them, but like, I fundamentally, if we are ever gonna really do housing first, of which I am a proponent, creating meaningful avenues to address significant barriers to long-term stability cannot be viewed as a negative. Like, that is not housing first. At any point in somebody's journey, they're ready to address a substance use disorder, a mental health issue, an untreated medical issue. I don't want to be putting artificial barriers because it's not going to look good on a graph. I don't agree with how you're looking at this, because if they are experiencing homelessness, which means they don't have a placement, they either are not in shelter or are in shelter, but they are not in permanent housing, and they go to treatment, and then after treatment, we give them housing. How is that a worse outcome than if they were in shelter and we just put them in housing? I kind of don't get that.
If I could, it's not. I think that this is just missing some language that if you're not in the system or have been in it, you don't know, which is, I think, something that we've got to work on is how to message this appropriately, because they are still considered homeless when they're in treatment. And it's why I keep asking, what are our outcomes for placement out of treatment and into housing? So I don't think it's seen as a negative outcome. When we talked about positive outcomes, I understand, but I'm trying to clarify and again, say to you that the way this is being messaged isn't clear for people. So it is not that it's a negative outcome, it just means they're still homeless. The housing is what they're measuring. I do think that we need to be doing a better job of talking about positive outcomes out of shelter, because it's not always permanent housing of my own, right? We don't talk about moved in with family or friends. We don't, unless it was a permanent placement. There's other things. When we did the shelter work session that I convened, that we talked about positive outcomes, and that seems to have gone to the wayside. So I do think that's important to talk about. But I think it's important that we also know people are still homeless when they're in treatment. And it's actually one of my follow-ups that I'll put on pause because I just wanted to engage in this conversation, but we have to be tracking placements out of treatment, transitional recovery housing, and into permanent housing, or whatever other positive outcomes might come out of that. And that's something I'm still seeing missing. And it might not be that it's a metric that is on HRS, but it's a metric that the department should be tracking.
Yeah, and we're talking here a little system level performance versus an individual success are also two very different things. Like all those placements into recovery housing, if your amendment passes, they'll be in our data. They just won't be in a permanent housing placement data set. They'll be in a shelter data set unless Metro changes how recovery housing gets categorized. Because right now, transitional recovery oriented housing is shelter right now. They changed that on us last year. So
I'm sorry, just Metro doesn't get to just decide. This is something that's bigger than them, but.
I don't disagree. I'm playing off of a conversation that the commissioner had.
But what I think is important, and I totally agree with Commissioner Singleton, of like, there's what we report to Metro, and then there's, as a county, how we want to measure success. And for me, it is critically important. I actually believe the way our homeless system is currently measuring and directing services disincentivizes people from addressing their behavioral health issues. I do. Fundamentally, it lowers your ranking. It takes you, out of being in line for housing. Like, that is, to me, ludicrous. That we are not actively figuring out, and I am still, again, with Housing First, we don't shut doors to people who aren't ready, but if we are really doing Housing First, we are constantly using assertive outreach to try to engage people in the things that are creating significant barriers to their long-term success. But if we set up a system that views somebody needs residential treatment, somebody needs inpatient psychiatric, somebody needs this, as not a win, we will never have the outcomes we want. So and I will talk to Metro. I have talked to Metro. I literally talked to them yesterday about this issue. But for us, we have to integrate behavioral health significantly more, and that has to also be reflected in how we talk to the public about success. So like for me, I am a little like perturbed about like getting people to address their substance use disorder and then not returning them to the street, which I think, well, we know if recovery housing improves somebody's chances of staying sober a year after treatment by 100%. It goes from 36%, I guess it's not exactly 100%, 36% to 77% likelihood of still being sober. And we are publishing a graph that says, your placement out of shelter is gonna look bad. Like, I get that. I get you were just going off a dashboard that was created. I'm not blaming you.
No,
but
I'm working off of county city approved system level key performance indicators where I'm asked to project the impact at a system level. And when we take away permanent housing placements and the funding that supports that placement out of shelter and put it into a temporary placement, that might be great for the individual. That can be true. And it also impacts the system level KPIs.
Although my
Those
question
both
to
things can
you
exist
is,
together.
yesterday I asked Homeless Services, why do we count if they are housed, even if they're not housed in the same recovery housing? Now, a lot of people at 12 months probably will be transitioning because the model is, you can stay up to 12 months.
Yeah.
We're gonna pay for 6 to 9 months, but they are expected to then pick up. It's a subsidized or a lower rent. But if they are housed 12, 18, and 24 months later, even if it's not the exact same place, how is that not measured as a success?
So I think part of what's happening here is, the housing type and how we count it. So there's rapid rehousing and there's transitional housing, and I don't want to get too wonky. I think we need to have a definitions conversation about what kind of housing your proposal is, because it's taking a rapid rehousing resource. And to your point, with rapid rehousing, we look at housing post-subsidy at 6, 12, 24 months. If they have moved apartments, but they are still housed, that's considered retained in housing. So, but transitional housing is typically considered still to be homeless by the federal government. How that is tracked with Metro has changed over time, but the one time only that we're talking about, that's general fund, so it's not SHS funding. But I think we need to be really clear on what kind of housing this would purchase and what that does with obviously the humans' lives, but also how we're tracking our success in the community. So there's just a little more like definitional work we need to do to really land on what this would be purchasing and how that impacts the KPIs and our performance measures.
And I guess my point is here, one, we put recovery housing in our joint agreement because I wordsmithed the hell out of it. But it was in there, so like we said we were gonna do this. I think it is inaccurate to say what's good for a person is not good for a system. I totally disagree with that. You said on a system level.
So both things can be true. With the way this is designed and approved at a system level, if reducing unsheltered homelessness is the goal, I'm going to continue to crank out this data as this is defined. And at the program level, the great outcomes that we can also report out on, there are other positive exits from shelter. That's what we're talking about here that aren't permanent housing. We have that data as well, but it's at a program level, not at a system level. Both things can be true.
Yes, but if you're not capturing that, if you're capturing that as a failure at a system level, even at a program level, I think that is an incorrect metric. And I guess that's a later conversation because
I don't think it's a good or a bad. It's the question of what ends somebody's homelessness is what that metric is tracking. And so did we end that person's homelessness or not? And if they went into treatment, the answer is no. We did not end that person's homelessness. So I don't think there's the value of
there's rapid rehousing.
good or bad.
Fully
It is.
How? How is that different?
It's not different than what you're doing, what your amendment does, which has been my point of those are already eligible uses of rapid rehousing. So it is, but you're putting value judgment on what I don't think is where they're putting value judgment. It is what is ending somebody's homelessness. But again, I do think the tracking and reporting out of positive exits from shelter has been lacking from this conversation.
And I
Although I'll just
agree.
say the framing is like, if these amendments pass, I think the implication would be like it will have a bad outcome, and I think
I'm offended by that.
that is just what's precipitated
So
the larger discussion.
I think what we're trying to get at, and I appreciate this conversation, and I also think that the positive exits from homelessness, unsheltered homelessness, is a very important way of talking about it, because this goes to what the mayor has been talking about in terms of reunification. It talks about entry into treatment. It talks about a lot of transitional housing, right? Some of these things that aren't just captured in what a federal definition might be, or it's not captured in the KPI that we're using. And I think that we're talking about two different things here. One is the effectiveness of our shelter system in getting people into permanent housing, which uses a definition of permanent housing that is not all inclusive of all positive exits from shelter. And then we're also talking about how can we, and this is something that I have, an issue that I've had since I was a commissioner, is that the investments that we make in individuals in terms of things like treatment or other behavioral health services isn't sufficiently can be a weight on somebody in terms of like their where they rank on a list in order to get into housing. I mean, there's a lot of things where we're not integrating, I think, behavioral health work in the right way to really make our system work for those folks. So I think both of the things are true. I do think that, and I appreciate that you're having conversations with Metro. I think we all need to be having those conversations because we do want to be able to, I think, have more options for that. And I think it is also true that the path that a person might be on who goes into a transitional housing after treatment is different than what the metric is tracking that Jillian is tracking, which is about how we can, especially with the number of shelter beds decreasing on both the city and the county side next year, how can we make sure that we are still having, capacity through the system to be bringing people off the streets and into shelter and housing.
And for the record, I did tell Metro that we needed to track positive outcomes. I also told them, as well as the department, that we need to be tracking and reporting on the outcomes out of transitional recovery housing. And that's one of the things in y'all's follow-up. You gave me a bunch of language about how you do contract monitoring, but you did not give me outcomes from transitional recovery housing. So that's something I'd still love to see as follow-up.
When I think about the future of the supportive housing services money, I think a lot of it is going to be a conversation with the community, not about the technical federal government definition, but have we actually gotten positive outcomes for individuals? So in some ways, I think it can be harmful to the overall goals to be sticking to to a definition that is a technical definition that we need to report and we have metrics around. But I also think that we're going to lose people if we say we spent all this money and like we got these bad outcomes, when actually there may be positive person level outcomes. I mean, for example, that's just like, I don't think anybody thinks it's necessarily a bad thing if somebody goes to live with their brother or sister or their parents or, or their adult child. And so if that's like, well, that's like, they're still homeless. I think the average person would be like, doesn't make any sense. And so just in how we frame things, yes, we need to be reporting things and we have sort of technical guidance, but I also think this sort of human-centered reporting is going to be, and ones that people would think like, yeah, that person is not homeless because they've been at, their sister's house or they live with their adult child. And so
Totally hear all you all that we want to make sure that we are tracking all the positive outcomes from the breadth of programs. Totally heard. We can work on that. One other thing I do kind of want to put out there is we do know that the federal government is focusing more on recovery housing, and that is something they are hoping to fund more. And we will to the extent that we're losing funding for other programs, we will need to find a way to backfill those programs and protect non-recovery oriented housing placement. So if we're talking about where our funding is going, I just want to put out there that I want to protect sort of the non-recovery housing placement that we have, because we know there will be other, the federal funding is going to pivot towards that in the next year. So that's just in the back of our minds as we're doing all of this planning.
Can I ask a couple of questions? It might be both a combo of you all and Health Department. And this may not be data that you have easily at hand, but I am unclear on how much recovery, transitional recovery treatment is happening that is part of our system, either funded by us, so that we have some level of data, and how much of it is outside of that. I am interested in the tracking of outcomes from all of those, regardless of funding source. And then additionally, I am interested in particularly the behavioral health shelter, where we've had outcomes. I think in the report you talk about how the outcomes are not necessarily permanent housing, but there are other positive outcomes, which is part of why I've been pushing for it not to just be a closed loop referral system, so we can get the folks we know are struggling in congregate shelters into these spaces so they can get assessed and into the proper level of care. So understanding the outcomes of those, because they weren't in the shelter report because they weren't about permanent housing, so those would be helpful to understand as well.
The bulk of our recovery housing is in the Health Department's jurisdiction, so we'll work with them on getting you that overview.
Thank you.
So another question I had about the chart. So the 10 million is one-time funding, right? Yeah. So if you get a one-time, you reduce a reduction in the increase is what it is. There's not another bucket of one-time money. If you continued on with this chart, it would go back up to the higher rate without that one-time money?
Yeah, I think what you're asking is, yes, the 10 million and one-time only money that we put in housing placement program offers, right, starts to bend the curve, but it is one-time only. Fiscal year 28. Right, we're going to have a serious discussion based on all the OTO that is on the prevention side, the placement side, and bridging over to the city where Portland Solutions is 90% OTO. Fiscal year 28 it's going to be tough.
Yeah, I think shifting a system like this is going to take multiple budget years, yep. And so this is sort of step one in that reshift and that rebalance. To speak of the people who were housed with that one-time only, we will be working with providers to understand that this is one-time only. We regularly check in on like how many more months of assistance will someone need, what does it look like going into the next fiscal year, and as we're planning for next fiscal year, we would get a sense of how many folks need to be sustained from that. So we will plan for that moving into the next budget year, but it is year one of a shift.
Right, year one with one-time only money. The other thing, and I think you've given this to me before, and I don't need it right now, but just what the ongoing permanent, that's not actually permanent, the 10-year permanent supportive housing, like what that is, like all in, between the services and rent and everything. Like what are we already committed to?
Specifically for permanent supportive housing, is that what you're looking to understand?
Yeah.
Okay, we can follow up with that, yeah.
I mean, if you take the SHS budget and as more people receive a permanent supportive housing, it's a baseline that doesn't go down. And so what is that baseline? And again, I want to be also thinking about, the potential cliff. I don't want to be thinking about the potential cliff, but
we have
it is out there if there's not a renewal.
I'll also just add some of the positive things we can highlight will be discussed at the next SOC meeting. We call those sub-indicators, strategy and program level goals that we will set tied to just fiscal year '27, so we can celebrate those successes along throughout the year. That it isn't just about the long-term projections, given the inflow we are facing.
I know I was out of the room, but did we get follow-up to my question about the capital fund and what those dollars are allocated for? I didn't see it in the written responses.
We did not do that yet.
Okay.
So it's set aside for a couple things. We are finalizing Harrison, so potential next year cost for Harrison build out. We are hoping to use some for in the event that the federal funding for the Cook Plaza severe weather improvements run over, have some set aside for that. We do also, as a department, need to re-engage in a long-term capital planning process about what our long-term capital plans are, so some of that would be used for that. We have also, if the amendment regarding closing the St. John's Day Center and looking for a new one were to go forward, that would be the only source of funding we might have for any improvements therein.
So that's why I'm asking, because I want to earmark some of it, so if you could follow up with actual numbers, that would be great.
Can do.
So speaking about the North Portland shelter, what's the length of that lease?
We own that building.
We own
It's a county-owned building, yep.
So can you provide us with a projection of if we sold it, what we think?
So the same building houses a health clinic, so we wouldn't sell the building. And in our follow-up, I believe we put in the cost that we put, it was around, I think it was $800,000 to improve. Yeah.
So it would just sit there?
I do not know what the plan for that space would be if it were not the day center.
But the intent is not to sell it, it'd be to hold on to it.
It's very small. Yeah. Okay, any other questions for HRS or HSD? Okay, thank you all.
Oh, sorry. I'm going to get back to the shelter closing. Thank you for answering all my questions that I had about the transition. And just to summarize, I've got it somewhere in my stack here, but I'm just going to, there were about 340 or so estimated staff who worked for the providers. They're closing the gap. That number, I think maybe it was 342 or something close to that.
So that is our estimate based, not necessarily specific to shelter closures. That is looking at the reductions that we're taking to existing contracts, how much FTE we know folks have in their contracts, and if they were to just take a proportional reduction, that's what it would look like. Lots of caveats to that, but yes, that's across all of our reductions.
Okay,
yeah.
but generally potentially a significant portion of that through the shelter.
Yes, there is a significant.
And this is more for just like getting stuff on the public record that we talked earlier about when people see that their contract may not be renewed and that there's going to be a cut in the budget. People start looking at like, I'm going to go look for another job. If you could speak to just on the record of what the county is doing to address that or help with retention so that services can be closed out versus before they get closed out, people doing the thing that they need to do, which is get a new job or move on.
Yeah, thank you for that question. So we are working with the providers to do something similar to what the county actually did when we closed COVID-19 shelters, as we were closing that out and transitioning some of them to being provider run or closing others. Essentially working with the providers to say, like, please communicate to your folks that like this program is funded through June 30th, for example. They will receive a paycheck through June 30th. If shifts reduce or if there's different kinds of work, they will still be paid through the end of that program. So that as a retention incentive for them to stay, and they can help with closure activities employees after the last guest leaves, et cetera. So that's what we're working with, is using their existing operating budget to tell folks they will get that paycheck through the end of that funded date, be it June 30 or August 31st, depending on the shelter closure date.
And then, so that's the people. And then we're going to get on Friday, and you've committed to a regular basis sharing how people who are currently in the shelters, where they're landing, to keep the county's commitment. Nobody's exiting to the street. They'll have options.
Correct.
That are reasonable, that will prevent them from exiting from the street, and you'll be able to provide that information to us?
Yeah, so you'll get the first detailed update on Friday, and it will be every other week after that. And we're using both HMIS data to see like exit destination and also what was offered to folks. So it's a combination of our own data entry and working with the providers to say, you need to be telling us, like, what are you working on with that person? What are the options they've been offered? So it's a combined set of information, and we'll have our first detailed report to you on Friday.
And this is not the county, but it will have impact, I think, on the county system. Is the city doing something similar with their, quote, 900 shelter beds that they, or whatever the amount is, that they're closing?
I can't speak to that, but we do meet with them regularly, so we can check in with them and see what they're doing. Yeah, and we're always happy to say, here's what we're doing. Like, would you like, particularly for the HMIS system, like they put data into HMIS. So to the extent we could support that, we'd be happy to do that.
They're doing a mix of both. I mean, they're consolidating some shelter, at least that's the plan. So when and if that happens, right, they are going to be moving people into other shelter. They also have that $2 million in housing placement funds that the city council did approve, that they are working on putting in motion.
Yeah, and the reason I asked is just like one population being served in some ways by different partners. Did you?
Yeah, I was just wondering, I didn't think the city did placement out of shelter, so I thought it was, I guess I made an incorrect assumption that they would have us help them do that, but whatever.
We did get the eviction prevention dollars, so. Yes, yeah, so, no, I agree. I mean, and we can continue to work on aligning our systems and making sure we're not duplicating. Every city councilor I talk to has that. Every single city councilor I talk to does not want to be duplicating services. So we just want to make sure that carries through to the rest of the city government.
I actually do have a budget note for that, and some of it's coming out of the eviction prevention work group, but I'm working with Councilor Avalos to potentially pass a similar one at the city of Portland so we can get some better alignment.
Okay, I'm going to let the HSD and HRS go. They will be here for further information. I mean, and don't go far because our first. So everybody should, yeah, don't go far because I know. They can run, but they can't hide. Okay, we are now going to be transitioning over to the discussion of board amendments. And again, appreciation to board staff, for all the staff in all our offices for helping to group these together. So everyone should have a printout from this morning that talks about the plan for how we're going to approach these and giving us some times and dates on our next work sessions to do this. Hopefully we can get through everything, at least touch on everything this week, and then we can delve into more conversations next week as needed. So first up is employment services, and board staff really, I think, worked hard to make sure that they were grouping them in terms of areas based on what they've heard in these meeting rooms, and then what has been laid on the table in terms of an order to talk about them that makes sense. So employment services is first for today, and the other employment and workforce. For employment services? Yeah. It's a delightful question.
So for the HSD, it's 30600.
Thank you.
So we have 3 different amendments here.
get pushed back up.
Hi, Chair. I just wanted to, I see Commissioner Moore using my beautiful budget book over there. But because that program was eliminated, the employment services, you would need to use last year's program offer, which I can get you a copy of immediately.
Just trying to look at the line items.
The dashboard would be the best place, but we can get both of those things for you.
And
I'm sure it's all contracted services, though. I think it's almost entirely
Yeah, I
contracted
assume. I
services.
just can't remember.
Yeah, absolutely.
but there is a program offer for the restoration.
There is, that would be in the requested budget.
Right.
So, so let us just get you a copy of it. Great. Okay, thank you.
It's in the proposed budget, wouldn't it be, Christian? Because I did a restoration of employment services.
So this is a question maybe for
It's not the full,
Jones.
what was, right, exactly, yeah. Yeah, 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 yeah.
That's what we need.
Yeah.
That is like, the employment services thing?
Okay. Okay, there's some conversation happening. So do we want to start talking about these amendments?
Yeah.
Okay,
Commissioner Behrman Edwards was asking me, what was the difference between the hygiene services, that the amendment that I put forward last week, and the employment services, the amendment that we're looking at today?
I was thinking you had two employment amendments, and that if you smushed them together, that was the full restoration, but you're saying it's not.
I think that
It's something else.
probably is a phone a friend from the department. I thought hygiene was that, the particular program that you're talking about had been wrapped up into employment services at the $4 million mark.
Correct. Yes.
Okay, so if you took your two amendments, it's the full restoration of the services?
Correct.
Which is the same thing that I have in 14C.
And that I have in 1D.
right.
So for the purposes of the common elements, is there like the possibility of just a combined amendment for the items that are the same?
I
I am
mean,
open.
honestly, that's a question to y'all. I introduced that was the first amendment I dropped, so. And it was a full restoration. So I'm not sure the competing amendments came after that.
Well, actually, I'll just say that mine was fully funded when I dropped it. I mean, it's a little bit different because yours has, I think, 2 million more of additional items in it.
Yep, but that part is the exact same thing as the competing amendment,
Right.
except for the pay for.
I was just trying to look for where there's similarities in the employment programs and the amendments.
So I mean, you guys can tell this by what I put in my proposed budget, but I have a lot of concern about full restoration of employment services in the budget reality that we're in for the Homeless Services Department and homelessness services overall. In terms, and just as I talk about, I've said it a couple different times, I don't want us to over-resource any one area of the system at the expense of a full work, an overall system that is working well. And so for me, we have, and I've been, like in the entire time on the board, I've seen our investments in employment services start here and go up and come down and go up. And as we've had different, SHS dollar allocations, and especially when we had a lot of the one-time only dollars, we had increased employment services. That was an area where we invested in. And so Just as, we're having to make really hard decisions around the number of shelter beds that we're able to sustain, I have the same concerns about employment services, and especially knowing that there are organizations or programs that are being funded 100% by the public county dollars, and that they don't, there's not any other kind of sustaining mechanism for them aside from these county dollars, knowing that, we have reduced dollars over the last 2 years, and we just definitely are going to have a new normal of those dollars. So I'm going to be really looking at the amount, that we're putting into employment services, and then absolutely the pay-fors of those in terms of like, what does that do to the other pieces of the system that we're trying to fund?
I can appreciate that. I think the one thing I would say is I have a budget note for this because I think we did a disservice to these organizations by not convening them to have a conversation about long-term sustainable funding. And so that's a part of what I think is our job to do, is say, hey, you all are a low barrier employment continuum, and it is a continuum that people can move through, and give them some opportunity to actually create what that can look like, understand what the cost would be, because I don't think the county's the sole funder, but right now I couldn't even tell a story to somebody else about what the employment programs do to ask for additional funds from any other outside sources. So to me, we need to give people a year, actually keep the programs running, but engage in an intentional conversation about what the system of employment services should look like, and bridge from these low barrier programs, because not all of them are low barrier, and bridge into the ones that are more around anti-poverty work, so that people can actually move into longer term sustainable employment. But for me, it feels like pulling the rug out from under a system that was set up without us doing the work of figuring out what it can actually look like and how to right size it.
I think one of the things that makes I too think about, like, it's not as if choices get easier next year and onward, but with employment services, there are a couple of options, and again, they are not guaranteed anything, and I take that with a grain of salt, but I do think some degree of employment services, it is not for every single person would qualify, but for those who qualify for 1915I, which is a low bar, and in fact, the state is looking at making it even easier to qualify. Now they want to strip the services out of it, and that's a different issue, but it pays for some of what's in employment services. So I do think that there's a couple of options. The job coaching can be reimbursed for some people. The supported employment, which I think is an element of some of these programs, can be funded. I don't want to lose the apparatus entirely when there might be a way of supporting some of this work. So it's a hard one because nothing's guaranteed. But I also, like, when you lose it, it's almost impossible to bring something back.
Yeah, I think there's a conversation around just offsets, seeing that all three of us put forward employment services. For me personally, it's been a huge resource for us out at East Multnomah County. I send, each and every time I run into one of our neighbors that's unhoused, I send them to two places: City Hall for our homeless outreach team and Cultivate Initiatives. And there's over 30 people that I know of personally that have actually went through the program, one of which is a gentleman by the name of Scotty. I met him in the middle of a laundromat 4 years ago. He was not himself. Now he's in permanent housing, went through workforce, and I don't know if he's sober, but he's clean. And that was, indicative of just the services that we provided through permanent supportive housing and then Cultivate Initiatives. For us, it's a huge resource to lose out in East Multnomah County, seeing that we don't have shelters and the ups and downs of all the services in general. And that's one of the reasons why I put forward the amendment, but we just have to figure out the offsets for it.
So just acknowledging your point, Chair, that it's 100%. I also think it's a very small percentage of the budget, and it's,
I was going to ask that, yeah.
for me, one of those things where what people is so much more than, it's a little bit like what the Pope said the other day about empowering people, like they have purpose, they feel like they have the ability to drive their own lives and become self-sufficient, which is different from a lot of the other supports that we give. I mean, and to me, it's a small amount of money that is empowering people who, oftentimes have been chronically unemployed and frankly aren't going to be able to step into a traditional job right away without this sort of stepping into the internship and sort of creating the work habits and also addressing many of the other things they need to address in their lives to move on. But to me, this is like one of our most empowering program and leads to, I believe, when you talk to people, housing and a whole bunch of other positive outcomes, access to treatment, getting on their road to recovery. I also am just going to speak to the fact that the budget as it's presented, the shelter reductions, there's, over 200 beds being lost in East Portland, the same kind of geographic area that the specifically Cultivate, but the Employment Services supports. I mean, I think it will be a disaster to East Portland to both close shelters, and then the city also, I mean, it's just cumulative. The city is looking at closing Reedway, which is, I think it's at 150 pods, but that's also in East Portland, and then combining that with eliminating the employment services, I think will have very, very bad outcomes for East Portland. And so I view this as one of the critical supports that the county is providing, especially in light of other reductions that are being made to give people a pathway to a better future.
Yeah, I'm agnostic. I mean, I'm willing to I'm willing to have a conversation around offsets and let go of my amendment, just as long as the funding for how those services are provided throughout the region, but specifically in East Multnomah County for employment services. Commissioner Singleton, do you want to walk us through your package first, and then we can just talk through the differences?
So because my package is bigger, it feels a little hard to talk about which offsets go to where, but I'll just talk broadly about my workforce package is the pre-apprenticeship stability investment of $200,000. That is a recommendation directly from the trades workforce table about ensuring that apprentices and pre-apprentices don't fall out of their programs because of sometimes minor income issues like transportation cost or needing particular supplies. And this is plussing up an investment we already have to the dollar amount that was recommended from that table and in coordination with county staff. The second piece is benefits retention for apprenticeship and training programs. That similarly is a recommendation from the trades workforce table. This I brought down. Originally it was 1.6 million. I brought it down to 1 million in the final amendment. This is part of the conversation we were having about the CDEF last week, question mark? Was that the board meeting?
Yeah.
And that work to ensure that people, they lose public benefits often because they make a little bit too much money, but not enough to not need some benefits and support. The third is the homeless services employment restoration. The only dollar amount specifically going to that, because it's SHS, is the North Portland Day Center reduction. And the next part of that package is behavioral health apprenticeship programs with an investment of $500,000. We can invest in 44 people getting credentials, whether it is addiction counselor 1 or 2, as well as people who actually can get QMHAs and QMHPs. So that investment is specifically to help address the behavioral health workforce shortage that we continue to have. I think there's some language in the impacts from the departments that I'll have to follow up a little bit with the health department on. My vision of this was actually that it would be serving county programs and would be a part of the health, behavioral health workforce serving across our shelter system. And then a summer works expansion, which we did last year as one time only, but particularly feeling like we've lost a number of investments in youth over everybody's budget this year, both city and county. So that is included in that workforce package as well. Offsets include a reduction to the COO's office. I mentioned the North Portland Day Center. It is some eviction prevention dollars, as well as the specific specialized outreach to Central Library. And I did that one because when you look at the response about geographic specific outreach, there are a number that target downtown as well as the Central Library already. So those 2 FTE, while I think would be nice, didn't seem like it would leave a huge hole in coverage for that area. And that's in addition to the outreach teams funded by Homeless Services Department. And then revenue amendments are used there. The vacancy savings for 2 quarters came from the report that Christian Elkin shared with us.
So I just want to, so the $1 million for the pre-apprenticeship and apprenticeship benefits retention, that is to pay for benefits for folks who are in pre-apprenticeship and apprenticeship programs?
It's to pay for things that they would have. So like, for example, they used to qualify for food stamps but don't and still need some financial assistance for something like that, or they might need some childcare financial assistance. So it's essentially, maybe benefits retention is the wrong wording, but that seems to be the industry language. It's really about making sure those support services are there for folks so that they don't leave their programs because they suddenly have a little bit more income.
Okay, and then the summer works, this is the expansion on what's already in the county's summer works budget?
Correct.
Okay. Sorry, I had one more question. And then the HSD employment programs, does that fully restore the employment programs?
It does.
Okay.
And then that piece in particular comes with a budget note to specifically convene Homeless Services Department funded employment service providers and discuss how they can create a true continuum of employment services to support people moving from low barrier to internships or apprenticeships and ultimately to permanent employment opportunities. So it gives some concrete pathway for people as well as for the programs to understand what they can do, see if there's efficiencies they can find, and how they can work together as a whole group of low barrier employment programs.
So I'm going to look again at where the similarities are. So again, I think what it sounds like what we have in common across 3 amendments are full restoration, and then Commissioner Singleton has an add as well. The other similarities is, and this impacts this goes to the note about how much the spending of the revenue in multiple times over. So there is, I think, alignment between Commissioner Singleton's and mine around the dollar amount and revenue amendment number 1, revenue amendment number 3, and I think I have 50,000 more from the revenue amendment 4 than Commissioner Singleton. And then I also looked at Commissioner Jones Dixon's, how he paid for part of it, and I have safety off the streets. So again, I tried to like, where are the similarities in the pay-fors? And then the last 273 was just from the vector control program. But otherwise, I say, there's some matching between Commissioner Singleton's amendment and Commissioner Jones Dixon on the pay-fors.
Yeah.
Right, that's what I was
Yeah.
acknowledging, so.
So I think what would be helpful is understanding, like, so when I did my restorations, I was really looking at which are some of the programs that are serving, like, kind of low barrier, right, easy to get into, really specifically helping people who are experiencing homelessness or recently experiencing homelessness, and having programs for them. So it's the entry point, and especially if we're using SHS dollars to fund some of that. And there are some employment services that we fund that don't necessarily focus on that specific population. And I think it might be helpful to take a look at, like, which programs are serving which populations in terms of restorations. So that's an ask I have for the department, to share.
Yeah,
If you have it now.
Could we get that? That would be helpful.
If you don't have it now, don't worry about it. Just, I think that would be helpful in terms of looking at.
Preferred in writing with cost anyway.
Yeah, so the programs, the cost, and then the population that it's serving. Okay, thank you. Okay. Okay. Any other discussion around employment services? We're just about out of time, so.
As long as we're on this is less about employment services, but I noticed you had the economic development. So this is there's no revenue impact. It's a shift of FTE from one place to somewhere else, and with a very clear portfolio. So I don't know if anybody, I noticed it, I'm not sure I would have included it with employment services, but just.
So I think board staff
If anybody had any questions about that, there's no pay for, because the position is a shift.
Yeah, do you want to, so this is what the board staff presented in terms of the topic. So for this one, it's taking a.
I'm only speaking to it because it's just there. but-
Yeah. So it's taking one FTE from the chair's office and moving it into a newly created economic development position, and you want that to start in January?
Yeah, it would be obviously represented position, but with a portfolio that would support the sort of larger economic development, also workforce, also connect into the affordability study that Commissioner Moyer brought forward and that the commission approved. So it's essentially taking a resource and making it be a like sort of county resource versus very specifically in the chair's office.
Okay, any questions about that one? Okay, great. So we got through our agenda, so we got through the things that they told us to talk about today.
3 minutes early, too.
I know. Okay, so we're going to get some more information. I'm sure we're going to touch on employment services again, because there's a lot there and a lot to talk about. And then we did not have a chance to hear from the departments in terms of the impacts of some of these offsets, so that's where I'd like to begin tomorrow. And then we can move through the rest of the agenda that they've laid out for us. If anybody on the board has, issues with what board staff has laid out in terms of the agendas, speak up sooner rather than later. But this is what we'll go with, so that the departments, kind of when their topic areas are going to come up.
Yes, I feel like miscellaneous said enough. They didn't then need to say random.
Random answer changes. They just like italicized.
We got it with miscellaneous, guys.
Okay. All right, thank you, everyone.
Budget notes.
Oh, and then, yes, any amendments or budget notes?
I have a couple of budget notes. This one is around our contracts. I think you all have heard me lament that some of our CBOs have multiple contract managers, so this is to actually do the work of figuring that out, whether it's within division or within department or across departments. The next one is around OCI and our CBACs and looking at some of the recommendations that came out of that, their work this year on the standardizing year-round recruitment, but also the way that some departments like DCJ's buybacks were listed, I thought were really helpful, and having them talk about some standardization there so that it's a little bit easier for the board to know where they stand. And then number 6 is the employment services that I discussed earlier. There's 2 parts to this, I will say. One is around the larger employment system that includes a lot of Work Systems, Inc. funded programs. And depending on how we decide on the dollar amount amendment and what gets funded, one or both parts of this may need to come out. Some of the programs like Home for Everyone program would live in the second paragraph. If that isn't funded, I'll pull this out and do an updated budget note. I don't want to ask people to convene if we're no longer funding them.
There were, Commissioner Moyer earlier had dropped 2 budget notes, and you have those. Any other budget notes or amendments for this morning? I know you had dropped 6 earlier, updated amendments earlier. Okay. All right. Well, thank you, everyone, for some great work today. That concludes our agenda for today's work session. Our next meeting will be the regular board meeting tomorrow, the regular board meeting May 28th at 9 a.m. We will see everyone tomorrow. We are adjourned.